Problems associated with reproduction. STIs can be caused by bacteria, viruses, or parasites. Examples include gonorrhea, genital herpes, human papillomavirus infection, HIV/AIDS, chlamydia, and syphilis. Genital herpes is caused by the herpes simplex virus. It's spread by skin-to-skin contact during sexual activity. There's no cure. It can have painful and itching sores around the genitals, anus, or mouth. Human papillomavirus, or HPV, is the most common STI. It's spread by skin-to-skin contact during sexual activity. It can cause warts, and in some cases can lead to cervical cancer. Chlamydia is a bacterial infection that can lead to permanent damage to women's reproductive system if left untreated. It often appears with no symptoms, although it can lead to unusual discharge and painful urination. Gonorrhea is caused by infection with the Neisseria gonorrhoeae bacteria. It infects the mucous membranes of the reproductive tract. Transmitted through sexual activity, it can also be spread from a mother to baby during childbirth. Many people are asymptomatic, but they can have discharge and painful urination. Left untreated, it can lead to permanent reproductive tract damages. It can be cured with an antibiotic. However, you can get reinfected if exposed to it again in the future. Syphilis is caused by infection with the Treponema pallidum bacteria. Transmitted through direct contact with a syphilitic sore and can be passed from mother to their unborn child. There are stages of infection. It starts with sores, then progresses to rashes, then has a dormant stage where there are no visible signs, then can lead to organ system damages. Some of these stages can last years and will continue to progress until organ damage, if left untreated. It can be treated with an antibiotic. However, treatments vary depending on the stage of infection. HIV, or human immune deficiency virus, is the virus that causes AIDS, acquired immune deficiency syndrome, in human beings. HIV damages the immune system so that the body is less able to fight infection and disease. Untreated, HIV most often turns into AIDS in about 8 to 10 years. Having AIDS means your immune system is very damaged. People with AIDS are more likely to develop diseases they wouldn't get if they had healthy immune systems. These are called opportunistic infections or opportunistic cancers. Some people get opportunistic infections during the acute stage of the disease. You can get infected with HIV if infected blood, semen, or fluids from a vagina enter your body. This can happen if you have sex. You may become infected if you have vaginal or anal sex with an infected partner. If you share needles to inject illicit drugs. Sharing needles and syringes that have been infected puts you at high risk of HIV and other infectious diseases, such as hepatitis. If you have a pregnancy, give birth, or breastfeed. Pregnant people who have HIV can pass the virus to their babies. People who are HIV positive and get treatment for the infection during pregnancy can greatly lower the risk to their babies. HIV can be prevented by using contraception that protects against STIs and by not sharing needles. For more information, visit the Mayo Clinic.